안녕하십니까. 남상치과 김기성 원장입니다.
Greetings, I'm Dr. Kim Gi-sung of Namsang Dental Clinic. Let me introduce a case and a video clip that I've done quite a while ago. In 2017, I did live surgery in Moscow Forum. I was given the honor of performing live surgery for the first time. So I was really dedicated to it. The live surgery was held in Moscow, and surgery was performed in Korea. This was my very first live surgery, so I was really nervous. Let me explain about this case. The patient was fairly young but lost a lot of teeth. The plan was to use 6 implants in the upper and to provide prosthesis up to the posterior area. This is an initial visit. The anterior 6 is made of porcelain, and you can see that both posterior area there's no teeth and there's only 3 residual teeth in the lower. Wire clasp RPD was used temporarily, and in the lower, the patient was using flexible partial denture. In order to do guided surgery, you need to merge CT and scan data, and when we take a CT, you need to make resin marker to increase convenience when merging. I use a tetric flowable resin most to form these resin markers. At the time, there was no scanner, so impression was taken. Model scanner was used to get scan data. Silicone was used to take impression. Super hard plaster was used to make model. If you come across such extensive case, you need to provide accurate bite information along with the primary model to be able to do accurate guided surgery and provide provisional. Bite records were provided to OSSTEM Center in order to do guided surgery. The plan was to place 3 implants each because the patient had small arch, although the patient only had 6 anteriors. The patient condition, as shown on the CT, the patient had very good bone quality, but it was very unfortunate that the patient had no teeth. In number 15, bone quantity seems slightly lacking, but overall, the bone quality and quantity was very favorable. Through merging via implant studio, and implant surgery plan was made. Implant placement position and angle was adjusted following the virtual prosthesis design. We chose the appropriate implant size following the bone quality. In number 17, 4.5 by 10 mm implant was planned, but the design was to use wide hole design. In the case of OneGuide, there's wide hole to place a 5.0 implant, and you need to use regular hole in order to place 4.5 diameter implant. In this case, provisional needed to be connected, and if primary stability was insufficient while placing 4.5, I would need to resort to 5.0. Therefore, in light of the possibility that I would need to use a 5.0 diameter implant, I chose wide hole design. In number 16, 4.5 by 11.5 implant was planned. This is a longer implant compared to what I normally use. The reason is because this case required immediate loading, therefore I chose an implant that was slightly longer. It's the same here, 4.5 diameter implant, but a wide hole design was used, and in number 15, 4.0 diameter was used, and in number 25, 4.0 by 10 mm implant was used. Regular hole was used in this case. In number 26 and 27, it's the same. Although 4.5 diameter implants have been chosen, wide hole designs were selected. In number 27, 4.5 by 11.5 millimeter implant was used.
사용한 임플란트는 11.5 임플란트를 사용했습니다. 그렇게 원가이드를
OneGuide was designed and template was designed. This was the end result. 3 implants were used to provide abutments and provisional restoration. The purpose was to restore masticatory function. I'm a kind of a worried freak, so even if you use guide using various data, there can be slight error. So always after making guide, I use CT checker. I do this before surgery. For surgery of this patient, OneGuide and provisional and abutments were all ready, and right before surgery, CT checker was connected and CT was taken to confirm everything once again. Surgical sites were confirmed and flapless surgery was planned. Accurate evaluation of guide was necessary before surgery. OneGuide was adapted. Adaptation was confirmed, and this is after implant placement. In number 15, 16, 17, and 25, 26, and 27, you can see that implants have been placed nicely, and abutments are connected here. This is on the day of surgery, and the patient is wearing provisional. Final cement was used to set the provisional restoration. This is after prosthesis delivery, and you can see that this is a provisional with screw holes. On the same day, 6 implants were placed. Non-hex type transfer abutments were used. Let's take a look at the final restoration process. After 2 months, impression coping, transfer impression copings were used to make model. And I always use CAD/CAM abutment, 1-fit abutment all the time. I made 3 1-fit abutments. And after removing the provisional restoration, customized 1-fit abutments were delivered. Abutment level impression was taken, and ER-type zirconia prostheses were fabricated. This is 1 month after implant surgery, and this is after 1-fit CAD/CAM abutment was connected. And after the patient wore provisional for several period, about 2 weeks later, abutment level impression was taken to make final prosthesis. After that, the patient's anterior teeth were damaged, and the implant towards the anterior side was used to provide a restoration once again, and this is the panoramic image of it. Unfortunately, the patient refused to take the final intraoral photo, so there's no image. Now let's look at the video of live surgery which I've done in 2017 Moscow Forum.
First, OneGuide template is checked for fitness. 조금만 있고. 조금만 이쪽으로 줘주세요. 석선. 조금 더 오른쪽으로. 네. 이렇게. 네. 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 Insertion RPM is 15 RPM. 네. 네. Picture depth and hex. 조금 이쪽으로 돌리세요. 석션. 머리 보지 말고. 오케이. 오케이. RPM is 15. 보실게요. We used picture driver for control the depth and hex positioning. 석선. 오케이. Wide hole. And second molar area. 아, 잠깐만요. 오케이. cortical part drilling. 오케이. 아, 그래요? 오케이. 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 하세요. This is initial drill. This area, I will use torque driver. 거의 다 심었어요. 오케이. 하세요. 오케이. 조금만 다 했어. 톡센치. 오케이. vertical positioning and hex positioning. 이렇게. 뉴턴. 준비해줘요. 10뉴턴. 오케이. 오케이. 응? 입에 뭐 떨어져 삼키지 마세요. 꺼져. 핸드 드라이버. 오케이. Okay. In immediate loading case, I will use non-X type abutment. Okay. 하세요. 다시.
다음 거 준비해주세요.
숙소 없나? 오케이. 이렇게. 아. 이렇게. 프로비저널. RP, 아래. 이렇게. 바이트. 바이트. 다 물어보세요. 오케이. 밀어줘. After the tightening the abdomen screw and fill the screw hole with Teflon tape, I will cement this provisional with RMGI cement. All pictures are well positioned. 자. 이렇게. 여기 조금 약하다. 이렇게. 가위. 시죠? 가위. 시죠? 이렇게.